Welcome, my name is Alexa Forte. I am the cosmetic coordinator here at Charlotte Skin and Laser, and we are so excited to welcome you to our UltraClear virtual event this evening. Be sure to stay until the end where you will get to submit your questions with a live Q&A from Dr. Elizabeth Roston and a special guest.
Hi, thanks for joining us on this video. I'm Elizabeth Roston of Charlotte Skin and Laser, and I'm here today to tell you about a new addition to our practice called UltraClear. It is a new laser. It is actually a fractional erbium laser, which, if I had to admit, I've been wanting one for a long time, and I'm glad I waited because this erbium laser is unique. It can deliver what's called cold ablation, and that's laser energy delivered into the skin without excessive heat transferred to surrounding skin. And when that's called bulk tissue heating or tissue transfer of heat, and we worry about it because too much of that, too much, you increase your downtime, increase potential side effects, and increase potential harm from laser treatment. So back in the old days when we did much more aggressive treatments, this bulk tissue heating was really kind of a bad thing. When I have cold ablation, I can achieve many of the same effects, but with much less pain, much less downtime, much less worry, quicker recoveries for patients, and just overall greater comfort. Also, UltraClear is highly customizable, as I hope you'll learn tonight. We can do a treatment with no numbing or with minimal, no downtime, just a real quick polish of the skin, a brightening. But we can actually do a treatment for deeper lines, wrinkles, and sun damage with different settings. I brought UltraClear into the practice because I was introduced this very new, unique, dare I say revolutionary laser that had a lot of unique features, similar to what we already offer here, but different in many important ways that I'll talk about a little bit. So that intrigued me, and I started asking several of my very trusted friends and colleagues, and universally they told me they loved the results from UltraClear. And well, I think I can say they said it's the best thing we've brought into our practice, hands down, in years. They just loved it. So the cutting edge technology and these rave reviews from physicians about the results they're getting from their patients made me think, well, I need to bring UltraClear in. We've had it here for about 3 months and have been very, very happy with it. UltraClear can treat mild sun damage or even mild blemishes left behind from acne, or just be used to brighten and polish the face. As changes progress from there, UltraClear can still be your answer as you get more sun damage, more dark spots, freckles, surface irregularities, fine lines, as well as deeper wrinkles and texture changes. UltraClear is so versatile that it can still be an answer for those changes as well. UltraClear can lighten and remove surface irregularities and pigment, but it also can initiate changes down deep in the skin, so that skin renewal occurs, new collagen, new elastin, and renewed extracellular matrix is stimulated. This renewal process makes the skin healthier as well as better looking, and that's one of the things we really love about the UltraClear laser. It also has a setting called laser coring, and laser coring can be used to tighten the skin, for example, on the nasolabial folds, the jowl and jawline area, and maybe even the forehead and eyelids. versatile. My staff and I just love the versatility of this laser. It feels like almost anyone is a candidate. Now this can be confusing. How is it that we can recommend UltraClear for a young patient and then also recommend it for that patient's mother or even grandmother? Well, it's the versatility. It's highly customizable. It's great for the young patient who wants to brighten or polish their skin, lighten a few spots or blemishes, and stay ahead of aging. At the same time, it can be used on older skin for more significant improvement in sun-damaged spots, deeper lines and wrinkles, and even, like I mentioned earlier with that coring, tighten the sagging. Another benefit, and one that I refer to a lot, is it makes the skin healthier. We can treat precancers and reduce the risk of future precancers as well as future skin cancers. It's a big plus when I can tell my patients we're making your skin healthier. Men, well, it's a great thing for men. It's really, at most settings, not very painful. We can just use topical numbing. The downtime is abbreviated, very quick recovery, big results with just a few treatments or even just one treatment. And it does not interfere with beard growth, so we can treat the whole face. Another plus is many men collect some precancers over time and it'll treat those. Acne scars, it's a great option for acne scars, even if it's just light blemishes left behind from acne or deeper scars or more surface change. We can choose a setting of UltraClear that addresses the specific acne scar. We can combine UltraClear with our other lasers, lasers that target redness, and lasers that target brown. And we can combine it with things we use for acne scars, such as subcision, and the cross technique for ice pick scars. Put them all together in the same session so that we get the best, the most optimal results just with one treatment. And then again, if you've got older skin, we can combine it with the laser coring to address sagging and crepey tissue. So we are pleased to offer UltraClear for all this versatility. So this is the UltraClear laser, and I thought I'd use it to explain a little bit about downtime. The downtime varies a lot, from very little to no downtime up to the more aggressive settings where there's a lot of downtime. It depends on what layer we're treating. So we have the ability with this laser to treat just the very superficial layer of skin. And that's called the 3D Miracle. That's the one where you can come in for a quick polish and no numbing and go home and literally have no social downtime. As we increase the amount of skin we treat or how deep we go, like a little deeper, still in the superficial skin layer, that increases your downtime. So we can either treat more of the surface, more density, you see the circles got darker, or I can go a little bit deeper, and when I do that, the impacts look a little bit more prominent. You still have very little downtime. You have some redness, maybe a little bit of swelling the day after, but you can see the impacts as we go a little bit more into the upper layer of skin and as we treat wider area, more of the skin. The other setting we use is just those fine little drills into the skin for deeper wrinkles. If I do this on your face, there's not much on the surface, so we're really not going to see a lot of impacts, but because it's going deeper, you're going to have more redness and more swelling. But I often combine this with that superficial setting, and so that adds a little bit of those visible marks that we had just talked about. So the deeper setting, We can do just the deep alone, and you don't really see a whole lot on the surface, but you have the redness and the swelling. But typically we combine, so you have a little bit of both. And again, the more aggressive we are, the more downtime you can have. So it's really, truly a customizable treatment to what you're looking for, what we're trying to achieve. It can be specific to an area where you have the most wrinkles or where we're trying to achieve the most results. And we can go lighter where you don't have much wrinkles or sun damage. The last mode that we use with UltraClear is the laser coring. And that's where the laser makes small little impacts on the skin. I'll make them more visible. These are a wider surface area on the skin, a larger hole, not a drill. It's literally like a little core. When these heal, it tightens the skin. These are slightly more prominent skin pattern right after the treatment. I don't know necessarily more redness or swelling, but you can really see them. You can make them out as looking a little bit different. They heal up just the same way the other impacts do, but we have found that the prominence of the pattern can stick around a little bit longer, closer to a week, and then sometimes when you look real close, you can still make them out. You can cover this with makeup, but you can still make out those little impacts. So that's the downtime. It's very customizable, and you can do. You can come in and get a heavy treatment because you got a little bit of extra time, and we really want to target some deep wrinkle areas, heal up from that. It's still a very quick recovery. With what we're doing with this, I used to tell you you're going to have a week of downtime. Now I tell you, by day 4, you can go out. You can cover up the little marks that you conceived. You can go out. Day 5, you're just ready to go, yippee skippy. And then you can come in and we just do a lighter 3D miracle and you're on your way, but it keeps things looking polished and fresh and still stimulating the collagen renewal for you. So I hope I've painted a picture of how we can use UltraClear alone or in combination with our other laser treatments and devices to achieve the best outcome for you. But none of this is a magic wand. Some of the changes that are induced by this laser you see immediately, like the brightening, the fine lines, the little bit of a polished look, reduction of brown spots and pigment. But the other changes, the improvement in the deeper lines and wrinkles, the skin texture, these occur over time, and we typically say 3 to 6 months. This is what occurs with the new collagen production, the new elastin production, renewal of the extracellular matrix. That takes time. So it's nice when you get that fresh polish, but we're really waiting for time to see these improvements. This laser makes very, very specific impacts on the skin. And we'll just call them little micro injuries. As those micro injuries heal, that's what's stimulating the new collagen production, and along with it, the elastin and the extracellular matrix. The extracellular matrix is kind of the home where your collagen and your elastin live, that structure. We want that to be rejuvenated and fresh. Gives your skin some plump and some resilience and structure. But these changes take time. So after an UltraClear treatment, we hope that you see some immediate improvement, but some real results will occur over 3 to 6 months.